Lovely to meet you all, and thank you so much for your precious time. I appreciate you're all very busy people. So I'm going to now do a couple of presentations with you. By all means, ask me questions, or we can obviously do that afterwards. That'd be great. So I'm just going to share my first one with you. So this is careers in health and social care. So can everyone see that?
Yep. We can see your slide, not presenting mode, but we can see your screen.
Oh, how do I go into presenting mode, Rosie?
From the current slide, you might want to click on.
Yeah.
At the top left hand.
Yeah.
And then it should.
No, it doesn't want to, I don't think. I've got it on slideshow, but
that's okay for me, as long as it's okay for everybody else.
Yeah, apologies, guys. So this is obviously to talk about careers in health and social care, and of course, what is social care? So social care, there is a difference obviously between the two, and this is social care providing personal practice support to help with people's live their lives, supporting individuals to maintain their independence and dignity, and to make sure they have choice and control. So the type of places that you may be able to work in social care is, of course, care homes, and of course nursing care homes as well. And of course, that's 24-hour care, and that's helping people that obviously live there in residential settings, and supporting individuals with activities, hobbies, obviously preparing and serving meals. There's personal care involved with that usually, talking to people and keeping them company. And I'm sure, some of it's crossed our own personal paths with care homes with their family. But that, some people like to work in a care home where they've got that consistent relationship with the service users, the residents that live there. So that's a very sort of key area that a lot of people want to work in. We also have, of course, domiciliary care, home care, and this is probably the largest area for needs of recruitment, because we've got much more individuals that want to stay in their own home. And of course, like I say, it's usually defined as domiciliary care or home care. And again, that's where the carers will go into the homes. They'll help with sort of like duties, domestic work, serving meals and doing some shopping possibly, personal care, administering medication, getting them up in the morning, getting them into bed, things like that. So it's really to help them to live independently as long as they can at home. So that's our dom care. There's also supported living. So supported living is where we've got individuals that they live in their own homes independently. So usually they might suffer sort of from mental health, or have, issues such as epilepsy, illnesses like that. So they live on their own, but they do need some support. So a support worker would normally work in a supported living service. And again, it's more about encouraging that independence, helping them with their cooking, probably maybe their bills, their shopping, their personal care sometimes, and again, sort of independent living tasks, and also going out to the community. So, of course, that's changed now. Fortunately, a lot of individuals are able to go out into the community. So there's, they'll take the individuals to maybe a day centre, they might take them swimming, the cinema, things like that. So that's what we call sort of supported living service. Also, there's lots of things that are talked about in care, and we call it sort of myth busting. So it's just some of the things that we hear. And the first one, for example, is it's all about working with old people. No, that's a myth. So obviously it's individuals, it can be older people, it can be people such as children and adults with physical disabilities, learning disabilities, mental health needs, of course, individuals that may be sensory impaired, and people with drug and alcohol dependencies. So actually it's a very broad spectrum of individuals whereby you're support. It's just a job where you do personal care and feed people. No, that's a myth. So care assistants obviously work in care homes, that will involve that. But obviously sometimes with individuals, it's just socialising with them, helping them get dressed, because again, it's encouraging that independence where those individuals can actually, be as independent as possible. So that's a real key aim now. And it's what we call sort of person-centred approach as well. So person-centred approach is really about that individual and meeting that individual's needs. And of course, everyone's different. So we don't have anyone that's exactly the same. And that's where we sort of define it as sort of, person-centred care. So that's a healthcare assistant. We've also got a support worker. So again, support workers are individuals where, it'll be supported living, working with those that maybe have severe learning differences or again mental health. Some individuals, of course, unfortunately, and are bound in wheelchairs and things like that, so they can live in almost like a home, a residential home, with maybe 3 or 4 service users, and you're going as a support worker and you'll primarily have one-to-one care with that individual. And there's, both of them are such great rewarding roles. Working in care is just a dead-end job. No, of course, that's a myth. So this is an example of a career pathway of someone that worked and started as a care assistant at 19, and then obviously went into care and support worker roles. And that's just an example of this individual's career pathway and how she moved up to become a manager. Then she looked after, she was deputy, then a manager, and then she's now a regional manager, and moved into a charity. So there is great career pathways. You can become a supervisor, senior. You can do a year in healthcare assistant roles or support work, and actually move into social care. You can move into occupational therapist role, a mental health practitioner. So there is real aspirations and career pathways in health and social care. So just obviously some information around the rewards that you have in care. And of course, the great thing about coming into health and social care is once you join your care provider, you'll have the opportunity to get a qualification in health and social care where the provider will fund you for that. So again, you can really, go forward. You can do your level 2, which also includes functional skills. You can do your level 3. And then, of course, then you could aspire to, if you want to become a manager, a home care manager or a settings manager, then you can progress to level 5. So there really is, a great career pathway for those individuals. Of course, there's apprenticeships, which, of course, is not an easier route for young people going into health and social care. But there are apprenticeships which we really do encourage. They're obviously over the age of 16. You can move into an apprenticeship, you could be an administrator, care worker, community worker. You can really, again, progress yourself. So, for example, at our local hospital, you can start an apprenticeship at level 2 as a healthcare assistant. You'll work with them for 4 years and move up to level 3. After that time, they'll fund you to go to Anglia Ruskin University, for example, to then become a nurse. So there's absolutely brilliant career pathways through the NHS, and obviously great to see that a young person wouldn't necessarily have to go to university for 4 years. You'll get the hands-on experience as well as obviously the training. So this is a case study, which I won't share with you now because I appreciate we're time limited, but I will send this, and it's a really good case study of an individual that she works in care. She's a healthcare assistant and she's an apprentice, and it's really good to see and hear how passionate she is about her role. Working in social care is a fulfilling and rewarding career. Of course, there's lots of flexibility, so that's really what helps individuals, particularly young individuals, but also, of course, adults, maybe, and women that have had a family, they want to come back into work. So the hours are really flexible. No 2 days are the same. There are career progression options, and of course, for me, it's very much about that job security. If you go into health and social care, you do have a job for life. It is very sociable and it's very varied. And of course, it is a job that really matters. And one of the myths that we hear quite a lot is, and I'm not sure if any of you watched the Ed Balls films that he did in care, but they were brilliant. And there was one particular young lady that said, I'm sick of everyone saying, well, you're just a carer. Well, actually, anybody that comes into health and social care, they're actually healthcare professionals. They're just as important as anybody in all settings across health and social care. So that definitely is also a myth. And this, again, just some case studies. So this lady works in domiciliary care. She loves it. Every day is different. She does something. And of course, really working in care, for me, it's about helping those people that are vulnerable and that really do need that support. And actually, you are really making a difference in someone's lives. So that's for me really key. And of course, there's some more videos for you to have a little look, and career pathways there as well, which hopefully is quite helpful. So I'll stop presenting this particular presentation and start the next one. So I have to get rid of this one first. It's not coming up. That's probably because I've got too many on. Right, I'm going to go into, there you go, there it is. So can everyone see that? So this is our local stats around Southend. And as you can see, you know, we've got a high number of jobs. Of course, I mean, the sector generally, not just locally, nationally, is in its real crisis point. There's a massive challenge regarding recruitment into health and social care. And they're just some stats for you to look at, which I think are really interesting. Obviously, looking at the turnover rate, which is, you know, still at 39.4%. So looking at some of those real stats that, you know, people that are experienced, you know, you don't need to have qualifications to get into health and social care. Really, it's about what we call your values. So your values are, you know, being kind, caring, empathetic. You know, you can't, of course, have that. You can't be taught those things. They're innate. They're in individuals, and you know, you can go on the programs. So we do the Halo program, which I'll talk to you about in a minute and show you. But this really does help individuals have that full awareness of what it's like to work in health and social care. And once they go on our Halo program, they actually then sort of decide which pathway they want to go down, really, which is so important. And it's such a broad sector that there's so much confusion. And obviously our program really helps to eliminate that. So again, Rosie will share all this with you. I'm going to stop sharing that one and then just go into the Halo presentation. So this is my program that I project manage, which is called Halo Southend. So we are a health and social care careers academy, and we do a program which is called an introduction into health and social care. So these are our KPIs. So we work with DWP for our funding. Obviously, it really is about supporting everybody in all roles of health and social care. So obviously what we just talked about, but of course we have voluntary opportunities, and you can, you know, work and you work in befriending service, which is brilliant, which is really about talking and being there for those individuals that live alone and they're very lonely, for example. There's also voluntary roles in Southend Hospital where the elderly might be waiting for transport, which usually can be several hours. So there's lots of voluntary positions as well as obviously paid work in health and social care. And these are just a few things. So of course there is end of life. We work with havens and different hospices with regards to end of life and things like that. Also respite, so and reablement. So we have lots of individuals that live on their own, and for example it might be a 50-year-old lady and she's broken her hip. So she'll need to be supported to get better and recover and have that support, because she may not be able to get dressed in the morning, showered, things like that. So again, it's very broad. So we offer a independent advice and guidance session. We work with Southend Adult Community College. We commission them to provide some of our training. We provide obviously employability skills, and we also provide post-employment support, which is really important because not everybody that comes on Halo is ready to start working straight away after course. It could be because they've got some mental health issues. It could be because you know, they've got children, they need to arrange childcare, all different sort of reasons, and we actually support them up to 90 days post program, which has really proved to be successful in getting individuals into health and social care. So obviously we have a website which is there, and also a Facebook page. We also work with Skills for Care, of course, which is a sector skills council, and we also have obviously a brand name. It's called Halo, which is brilliant, and we've been running since January this year. So programme content, so this gives you just an example of what we cover, and some of these topics are topics from what we call the care certificate, which is offered when an individual joins a care provider in their job. So we cover, you know, dementia awareness, you know, topics such as safeguarding, which is really important. We do an accredited first aid course. We look at also managing anxiety and returning to work, because that's been a key thing for some of our candidates, even young individuals that have been really impacted by COVID. So they may be suffering some issues such as not being really very confident about going out and things like that. So we've really tailored the programme where we work with Mind for some sessions and also Trust Links. And of course, some of the areas we also cover is person-centred care. We talk about PPE. Obviously, of course, we have to talk about COVID, which we actually talk about on day one, to ensure now that everyone has to be double vaccinated, and follow that pathway. That's going to be mandatory come April 2022, but it is currently mandatory in all care homes settings at the moment. We do fluid and nutrition, food nutrition, infection control. So we really do cover a very broad spectrum of topics on our session. We work currently with around 67 care providers and of course South End NHS to promote all their vacancies, which are very high. They're running at a very high level at the moment for all job roles. And we guarantee job interviews with all the individuals that go on Halo, which is brilliant. So they don't have to drop their CV in Indeed, for example, which is really helpful. And then we match them. So, and also on Halo, we're doing 2 campaigns at the moment. One is getting men into health and social care. We have 80% of women working in health and social care. So we're really doing a lot of work to encourage men, young men, all ages coming into this sector. And so far, we've had 7 gentlemen on our Halo programme. They've all got jobs in support work or healthcare assistant, and they absolutely love their job and they make great carers. So that's my presentation on Halo programme, which is what I manage. So I'll just stop sharing. And obviously, I hope that was okay. It was a whistle-stop tour, but hopefully that was quite interesting.
That was absolutely fantastic. Thank you, Sarah, for that presentation. You really highlighted the value of care roles themselves, but also how care can be a fantastic opportunity to progress further in health and social care roles. So thank you very much.
You're welcome.
Really useful PowerPoints, and people have asked, can we share them? And absolutely, they'll be shared after this session, all 3 PowerPoint presentations. So we've got a couple of questions in the chat, which we'll start with, but if anyone else has got any questions, please pop your hand up. So Jill Close from DWP, Support for Schools team, has said, are there any opportunities for people to be employed in this sector with additional needs? So if I'll hand it over to you.
Yeah, no, absolutely. So we work with several care providers and actually in supported living. So that's those individuals. And we have had a couple of individuals that have had some learning differences that are quite mild, but actually they've now secured a job and they're doing a great job and they love it. So yeah, absolutely. And actually they make really, they make really good carers because they can really connect with those individuals and fully understand them. So yeah, 100%.
Sarah, can I just carry on with that?
Of course.
Have you advertise any vacancies for, those, or work experience? Do you do anything like work experience?
Right,
or
obviously, yeah, work experience is extremely challenging. Obviously, I'm sure you could appreciate in the sector at the moment. I mean, COVID unfortunately has returned to care homes, so they're particularly strict again with who visits. So, work experience has been something we've not been able to do. However, what we have done, which I'm commissioning now, is I'm just doing some filming in a support worker role setting, so supported living, and a filming for what a day is like as a healthcare assistant in a residential care home. So those videos will be released, and obviously I'll share them with Rosie once they're here. I'm also going to have one commissioned for domiciliary care. And also I'll have some videos on NHS as well. So basically for me, it's about trying to get those individuals to understand what are the settings like and what is a day like as a healthcare assistant. And because we can't do the work experience, that's why we're doing that, which hopefully will really help showcase, the closest we're going to get to work experience at the moment, I think.
I'd be really interested in having a copy of those videos if you don't mind, because we...
Yeah, no, absolutely.
Thank you.
And obviously on some of the links that I sent you, and I've got some other information that I can send you of some really strong videos. So they're case studies, which are really good. So I'm more than happy to share those with you as well. And some, because obviously time today, I probably would be quite happy to sit here talking to you for an hour and sharing lots more with you. But yeah, I'm more than happy to send all that to you, which would be great. With regards to ages, no, there's not. I mean, there's no age that I mean, I think historically there's always been a bit of a barrier and a challenge in health and social care where they've said, oh, well, they have to be 18. There's no legislation. It's not about health and social care. I mean, for me, it's really, supporting anybody that really wants to come into this industry. And you can be an apprentice, of course, at 16, which care providers will accept. And of course, also what's been really good and that's proved to be very successful is the Kickstart program. So individuals that maybe are slightly older can go into Kickstart as well. So there's, some really good pathways. I mean, usually the average age of coming into health and social care tends to be about sort of 18, 19. But of course, we welcome younger individuals because we want to work really closely with you so we can really start to showcase health and social care with schools and get young people to maybe start looking more into that particular industry. And of course, interestingly, we had quite a lot of young people that come on Halo that have actually looked after a family member, either their mother, their father, their nan, their granddad, or of course they've got siblings or family members that have learning differences. And actually, they're the individuals that really want to go into the sector because, of course, they've had some, hands-on experience.
Fab, thank you, Sarah. And just picking up on your point, Jill, about the additional needs in this sector, you might be aware that Southend Hospital have just signed up to a supported internship programme for, I think, 15 individuals, but that's something that could grow. But if we hear more information about it, we'll let you know.
Well, that's fabulous. I didn't know actually, but I mean, how's that gone out? Is that gone out to certain schools or what? I
think it's really early days with the planning, but they've just signed up to commit into, I think, 15 individuals. But if I find out anything else, I'll let you know. I think it's referral based, but I'm not sure who's doing the referring. So I'll let you know. Okay, so we also have a question in the chat which is being answered by Amir, but just worthwhile is Halo available to Essex residents? And Amir has said majority Southend because we're funded by Southend DWP, but Rayleigh and Rochford residents as well. Sarah, do you know if there's any similar programmes across Essex that young people can or residents can tap into around care?
Yeah, there is some programmes. The Prince's Trust are a programme as well, so I'll send you and share that, which is all of Essex. Halo at the moment, like you say, is just focused on Southend, so with Shoebury, Rochford, those surrounding areas up until Rayleigh. And of course, we are hoping to maybe potentially extend that and go a bit wider in Essex, but of course that's all pending on funding and we just don't know at this stage. So obviously we'd love to widen our programme because it is probably one of the best programmes out there across Essex. So we would love to do that and we're hoping that might be a future aspiration.
Fab, thank you, Sarah. And we've got a hand up from somebody. I can't see that, so if you've got a question.
Oh, hi, yeah, it's me. Yeah, hi. Yeah, I suppose moving on from working with young people with some special needs.
Yes.
I believe Basildon Hospital also have supported internships, and I think hopefully I'm in the north of Essex, so we haven't got anything like that at the moment. But the other thing is, I wondered if you knew of employers who offer inclusive apprenticeships, or whether any of the hospitals would be open to that.
Yeah, I'm sure they are. Like I say, Basildon, I know, are doing quite a lot of work. And again, I can share the information for Basildon. Oh no, North Essex are also doing a lot of work at the moment.
Oh,
and I've got the contacts. I've got some contacts for North Essex, and I'll share them to Rosie, who can give them to you. Because there is a lot of work happening at the moment, particularly with apprenticeships and interns as well. So which is fantastic news. And they really are. And once you sort of see a great scheme in Basildon or Southend, normally it will mirror.
Yeah, I'd heard they were looking to roll out, but I was also thinking of whether some of the care homes whether care homes know about inclusive apprenticeships so that they could take on young people who perhaps have fewer qualifications or take them on, not full time, let it last longer, so it's not you know, quite as intensive as an apprenticeship.
As an apprenticeship, yeah. I mean, I think obviously, of course, apprenticeships are different now with regards to the timelines of apprentice. So, you know, it's difficult when you have a part-time, what we call a part-time apprenticeship, that spreads over sort of 2 years or sort of 2.5 years rather than a year. That's then challenging for the employer, of course, because then they have a employment contract with that apprentice. I think that's what's caused maybe the sort of challenges with that. But definitely with the internships, I think that's a really good opportunity. And for me, and again, I'll give you contacts for North Essex, but if they work with, which they will do, local care providers that do support work opportunities, that's really where those opportunities lie. So, you know, you can certainly speak to them about that and find out if they've got any employers that you could speak to, or they might be aware of some.
Okay, thank you.
You're welcome.
Thank you very much, Sarah. Any more questions for Sarah in this session? If not, would you mind dropping your email into the chat box, Sarah, that anyone can contact you after this and link up? Right, we've got one more question that's come through from Jill Close at Support for Schools. What would really help schools is if you can demonstrate how health and social care fits into school subjects. A big one for schools at the moment is the Baker Clause and being able to link careers to the curriculum. If your videos demonstrate what subjects can feed into this sector, I think schools would be interested in seeing them. So just something to bear in mind. That's absolutely massive, Sarah, at the moment.
No,
linking
yes,
to
I've actually heard of the Baker. I've heard of that. So, and again, because I work with some other individuals within the South of Borough Council, this actually has come through, and we've seen some really good examples of that. So again, I'll share that information with you to Rosie, where actually it's looking at that link between health and social care and that regarding the subjects and how that all links. Which, of course, again, this is happening across Essex. It's not just Southend. So I will do, and they've got some really good models actually. We met a lady last week. And I'll share those details with you. So again, hopefully that's really helpful, because that's really what we're trying to do is, like you said, that's a big, massive thing, but we're looking at how we can map that in, and how, you know, that really will then help, like you say, and make a huge difference.
Thank you so much, Sarah. You're so knowledgeable about the sector. You really are the person to go to. So yeah, everyone can contact Sarah directly following this, if you pop your email in. But yeah, we've got one more message that's being typed.
Yeah.
Maria, did you want to come off mute and ask the question? Oh no, it's just to say, Sarah, thank you so much for today. It's been really useful and the PowerPoints were great. So thank you very much for that. And thank you so much for the session, Sarah.
Yeah, lovely to meet you all as well. And you know, please do, you know, email me if you need anything else. You know,